Today I'm going to go through how to take care of a zit. I think that we've all heard about this, but I just want to walk you through the entire process. So I get pimples. I happen to not have one today, but we all get pimples still. So let's say you have a deep pimple on your chin. It's tender to the touch. It is red, but it is not white, and it is still really, really deep. Let's address that first. Those deep, tender pimples you cannot squeeze to make pop or come to the surface, and by doing so, you're just gonna scar your skin. The things that you can do, if it's hurting a lot, actually taking ibuprofen or anti-inflammatory will help with the swelling and the inflammation. Totally safe to do. You can put a warm washcloth on it for about 10 minutes to try to sort of loosen up that inflammation, help with the pain, and ideally slowly start bringing it to the surface, which will make it easier to treat. You can call your dermatologist and ask to be seen for a Kenalog injection, where we actually inject an anti-inflammatory into the pimple to make it shrink and go away faster. If you're getting a lot of deep pimples, meaning 5, 6, 7 a month, that's when you really want to talk to your dermatologist about going on oral medication to control that, and so you don't have to deal with these deep, very often scarring pimples. That's the deep ones. Okay, so now let's say you have a more superficial one. Let's say you have like one that's closer to the surface, is starting to form a whitehead or almost has a whitehead. If it's getting close but it doesn't have a whitehead yet, then you go back to the warm compresses. So you put a warm washcloth on it for about 10 minutes, and that should bring it to the surface. Once it has a whitehead on it, that's when you actually can pop the pimple. How do you pop it? Well, ideally you would wash your hands. You would have a needle. It can be a sewing needle. I actually have like surgical needles because I'm a dermatologist. You want to wash your hands. You want to make sure you use a clean needle, and then you actually want to go in and just poke the bottom of the pimple, and then you want to gently squeeze the white out. The reason why you have to pop the pimple before you squeeze is you don't want to squeeze all of that white down deeper into your tissue. Your body's trying to get it out, so you have to give it an exit strategy. When you squeeze, you don't use your nails, you use toilet paper or tissue paper, and you sort of gently milk it out through the opening you made. After you do that, there may be a little bit of bleeding. That's when you get the washcloth, but this time you put cold water on, and that will help close the hole that you made and help stop the bleeding. After you've done that, that's when it's actually fantastic to use one of these patches, and you can put a patch on the little wound that you made, and that might get a little bit of blood in it, but it will just contain everything and keep drawing out the white stuff to make the pimple go away faster. Now, third type of pimples, blackheads. Now, if you have a bunch of blackheads on your nose, that can actually be pretty easy to make significantly better. We can't make the propensity to make blackheads go away, but we can make the blackheads appear smaller and less black. So at night before you go to bed, you want to use something that's going to promote cell turnover. That is ideally tretinoin. It can be retinol. It can be glycolic acid. It can even be salicylic acid. But you want something that you do on a regular basis in your oily areas, your blackhead areas, to help promote cell turnover. In addition to that, about once a week, once a month, depending on how oily your skin is, doing a mask, and charcoal or clay masks work really, really well for this. Apply that in the areas where you have the darker, bigger blackheads. Usually that needs to stay on for 10 to 20 minutes. You wash that off, and then your pores will really look lovely. You get back onto your turnover treatment, retinol, glycolic acid, at night before you go to bed, and that should really contain and prevent those pores from getting too big and black. There you go. That's the breakdown for deep whiteheads, blackheads. Let me know if you have any questions. All of this will be on our blog as well. Thank you.